A just published book and PBS Frontline Investigation, both called League of Denial, examine the way the NFL has dealt with allegations that playing football can lead to brain damage. Of particular concern is a condition known as Chronic Traumatic Encephalopathy, or CTE. Dr. Zachary Litvack, neurosurgeon and director of neurotrauma at George Washington Medical Faculty Associates, joins us to talk about CTE. Doctor, what is it? What is CTE?
Mark, chronic traumatic encephalopathy is a dementia-like illness that's seen in athletes, soldiers, and other people who suffer multiple repeated blows to the head over a long period of time.
So, when we're talking about football, is this from concussions? Is this from playing football and getting injured, suffering concussions while playing the game?
Yeah, our best understanding of this is that this is the long-term result of repeated concussions. And it's important to understand, and can be confusing for some people, because a concussion is defined as an injury to the brain that results in some temporary impairment, but there's no radiographic abnormality. So when you get a CT scan or an MRI scan on somebody who's had one concussion or even multiple concussions, it may look totally normal.
So how do you go about diagnosing it?
Well, that's part of the problem, and part of the focus of this book and this Frontline report is that up until recently there really hasn't been a way to diagnose it except by doing an autopsy. And there have been some studies out of UCLA recently utilizing specialized imaging called positron emission tomography that may hold some promise for being able to diagnose this in its early stages before irreparable damage has been done.
So are there any signs or symptoms?
Well, again, that's part of the problem. By time people recognize that there's a problem, and many people would nod their heads and it would seem familiar to say, oh, well, this person used to play football, they used to play ice hockey, they used to box, and now they're forgetful, they are impulsive, they have personality changes, they seem depressed, they seem suicidal, they seem angry. All of these things are very late manifestations, and so by time you see major clinical symptoms that doctor or even a layperson might recognize as a problem, it's too late. The damage has been done.
So is there anything we can look for?
Well, a lot of smart people are working on this. As I mentioned, there's one group working on some imaging studies to be able to diagnose this earlier. Other people who have been working for a long time on blood tests for Alzheimer's and other forms of dementia are working on this. But right now, the best we can do is prevention, either preventing the injury in the first place, or if a single concussion is sustained, making sure that a player is removed from play long enough so that the brain can fully recover from the injury.
Well, what's long enough?
Well, for some people it may be out for the rest of a single game. Other people it may be out for the rest of the season. And if there are signs on neurocognitive testing of cognitive dysfunction, memory dysfunction, other neurologic dysfunction, they may be out of the sport for life.
Well, I guess a lot of parents are thinking about their youngsters watching this documentary or this Frontline investigation and hearing about the book. So what do you tell parents who have children playing, whether it's local neighborhood leagues, pee-wee leagues, high school, college?
I think there are three very important things for parents to understand. One is that the brain doesn't stop maturing until nearly age 21. And so when you're playing pee-wee, grade school, high school, even collegiate sports, that brain is at more risk for injury than an adult brain is. The second thing that's important is my rule of thumb, which is one and done. If you get a concussion in the game, you're out for that game no matter what. No matter how normal you may appear to the parent, the coach, the physician at the side of the field, you're done. And you don't go back to play until you've passed a series of escalated tests to make sure that you really are back to your neurologic baseline. And as I said earlier, sometimes with a particularly bad blow to the head, it may be that I suggest that they're out for the season. The last thing I would tell parents is that, there is absolutely no reason why you should ever forgo protective equipment or skimp on protective equipment. That is really the only thing, if your child is going to be playing a full contact sport, that is going to prevent them from developing some of these injuries.
Well, you're talking about helmets. What in addition to helmets?
Well, there are certainly different types of helmets. There are different qualities of helmets. There's full gear versus partial practice gear. Everybody should be in full gear all the time. There's no reason why in a practice you can't sustain the same kind of injury you would in a normal game.
Well, what about the size of the helmet? Are kids, and when I say kids, I'm talking about the full range. I mean, are they wearing helmets that are too big because they're uncomfortable to put on? Is that something that you're seeing?
Well, an appropriately sized helmet is important, and along with that size, you have to weight it appropriately for the player. So obviously, a younger child isn't going to be wearing an NFL type helmet. It's going to put too much strain on their neck, and separate from what we're talking about, they may sustain other injuries. So I would say appropriately sized and weighted and padded helmets, but beyond that, it's still a moving target.
Well, once a player has suffered repeated head injuries, are there treatments available?
That's the big problem, and another thrust of the book and the story is that there is no treatment, that this is the end result of accumulated damage at a cellular level that is irreversible and not treatable.
We keep reading about and seeing these stories about former NFL players who have committed suicide and left notes about feeling crazy or helpless. Do you think most of those players had CTE?
Well, it's hard to make a diagnosis simply by the circumstances of their death or a note or a suicide note that they may have left behind. There certainly are recurring themes. The player that this was originally diagnosed in, Mike Webster of the Pittsburgh Steelers, he left a note behind saying that he felt like his mind was slipping away and that there was something wrong with him. And he actually bequeathed his brain and said, I want somebody to look at it. At the same time, when we look at players who have had particularly violent deaths or circumstances surrounding their early death, there have also been a lot of cases where there is either pre-existing mental illness or a family history of mental illness or other circumstances that the injuries may have exacerbated, but you couldn't necessarily say definitively it was all just due to the repeated trauma.
What else do we need to know about CTE?
The most important thing that we can do is prevent it. We can't effectively treat it, but we can prevent it from happening.